Hi, I'm Annabel, physical therapist. I'll be discussing fall prevention techniques or techniques on how to stay safe. Falls can happen to anyone, and you are at greater risk of fall as you age. The good news is many falls can be prevented, and these are some tips that you can do to stay safe. In the living room, you can keep wires and cords out of the way. Arrange furniture so that you can move around easily and safely. In the kitchen, move items to a lower shelf for safe handling. Use assistive devices like a grabber or reacher. Make sure that wires and cords are out of the way too. Make sure that spills are cleaned up right away. In the bathroom, install grab rails on the walls beside the toilet and in the shower. Use non-skid mats and use a shower chair and portable shower head. In the stairways, install a rail on either or both sides of the stairs. Keep steps well lit and free of clutter. In the bedroom, get up slowly from laying down to avoid dizziness or falls. Keep packed to the bathroom, free of clutter, and use night lights. If you go outside, make sure to keep all sidewalks free of brush and clutter. During winter, keep paths free of snow and ice. Have walkways prepared, and also make sure walking aids are used if you need one, like a walker, cane, or help of another person. So what else can you do to take care of yourself? Get regular checkups from your doctor. See your eye doctor once a year. Get your hearing checked every 2 years or as needed. Take good care of your feet. See a foot doctor if needed. Exercise regularly. Try an exercise program that helps with strength, balance, and coordination. Other general tips to remember is to wear rubber-soled shoes to prevent slips. Wear clothes that fit properly. Wear glasses if you need them. Keep your phone close to your chair and bed. Remove small throw rugs, and if you need to go to the bathroom at night, consider having a bedside commode or a urinal by your bed. See your doctor right away if you have dizzy spells, you have become more weak or unsteady on your feet, you have foot pain, or have difficulty walking. Other safety tips is to keep emergency numbers in large print near your phone and think about getting an emergency response system. Ask your healthcare provider about one. Hi, I'm Annabel, physical therapist. So what I'll be discussing today are some basic balance exercises. So one balance exercise is marching in place. So you can use a chair in front of you, or you can stand in front of a sink to hang on for balance. And then lift your hip up like this. So you can do this 15 times, okay? So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Second balance exercise that you could also do is raising your heel up. So you can raise your heel up like this and make sure you don't bend your knee while you're doing it. Make sure when you do this, it's coming from your ankle. Keep your knee straight. So you can do this 15 times again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, and 15. Make sure that you don't lean forward while you're doing this. So another balance exercise that you can do is raising your toes up. So same thing, you hang on to the chair and raise your toes up 15 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Next exercise is kicking to the side. So you just lift your hip to the side. You do it 15 times. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Alright. While you're doing that exercise, make sure that you're not going to the side like this. Make sure you're strong and straight when you're doing it. Okay? Do not lean to the opposite side. Okay? So another balance exercise that you can do is standing with your feet together. So you can start this exercise with chair on both sides for balance, depending if your balance is not so good. And then you can progress the exercise later on with just one chair on either side, either the right or the left, depending on your preference. Now, although the progression of this exercise is standing without any support, okay? So, but you can still have the chair on the side just in case you lose your balance. You can hang on to it. And once you regain your balance, you can do this again, okay? Without holding on to any support, and then count for 10 seconds. So count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. With your one foot in front of the other. We call this Tandem Stance. So when you do this, same thing, you can have support on either side, or you can have both if you need to. If you can tolerate, you can progress it to standing without any support. So try to balance yourself. Make sure that if you do lose your balance, that you hang on to the chair. But if you can tolerate it, you can let go and try to maintain this balance or this stance for 10 seconds. So you count for 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then do it on the other side. So another balance exercise is standing on one leg. So what you could do is you could use a chair on one side or both sides again, depending on how much you can tolerate. And then what you're going to do is you're going to lift one leg up. Okay, make sure it's not leaning on the other leg. Make sure you keep it up like this and try to maintain your balance. If you can tolerate it, you can let go, right, and hold it for 10 seconds. So you count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then you can do it on the other side. Hi, I'm Annabel, physical therapist. What I'll be discussing today is a proper technique on how to get up from a chair. First step is to scoot your body or your bottom to the edge of the chair. Second is to move your feet under the chair. Third step is to lean forward. And if you have an armrest, you can use the armrest to push yourself forward and up. Okay. So the proper way to sit down is first to make sure that you can feel the chair behind your knee. Second is that you reach back if there's an armrest, or if there's not, you can reach for the chair and then lean forward and then slowly lower yourself down.